I have everything ready for my client for the assisted teeth whitening treatment that they're going to have today in studio. I've got a placemat lined out. I use dental bibs for that. I've got their little kit with the toothbrush and toothpaste so that they can prep their teeth before I perform the service. This also includes a vitamin E swab for after the service is over. They'll brush their teeth and rub the vitamin E along their gum line to help with any sensitivity. I've got a cup for rinsing. After every 20-minute session, they'll have to wipe the gel off, rinse, wipe their mouth, and then start again. It's basically like 3 services, one every 20 minutes for up to an hour. They don't have to complete all of these. Some clients are happy with just one 20-minute treatment. If that's the case, great. Pack up the rest of their items in their take-home kit and they're good to go. Others will want to sit for the maximum amount of time, and that's fine too. But they will need one of these cups to rinse in between. I have their glasses. These are for them, not for you. If you feel that you are looking into the light a little too often, then go ahead and get a couple pairs of these, one for you and one for them. I have the dental bib clips. This, of course, is going to go around their neck, and you'll clip the dental bib that's inside the Bronzeberry teeth whitening kit to this dental bib clip around their neck. I have a mirror to help them apply the gel. I'll hold this mirror while they'll hold the syringe and apply the gel. Let's take everything out of your kit. The kit includes an LED light. If you don't have one of these larger machines, that's okay. You can perform this service in your studio or mobile session on your own with just the light that comes in each one of these kits. They'll get great results either way. You're going to take the light out of the bag. You're going to open it up and the batteries are going to come out. That's fine. You need them to come out because you need to take a little plastic disc that's inside. Take that and we'll discard that later. Put the batteries back in and test your light to make sure that it works. You always point your light down. You never point it up or to your face or out to anybody else's face. Point it down and you can see you've got a nice bright light. You've got your gel and your brush tip. This is the secret sauce. Your brush tip goes directly over on top of the syringe, just like that. When your client is ready, they will push using their thumb, holding on to the brush tip till you see the gel on the brush tip. And you can do this part. You can put this on and have it ready. When your client is sitting down, you'll give them the syringe, you'll pick up your mirror, and you'll guide them through the process. Don't throw away this cap. They're going to need it after the treatment's over. You'll cap the syringe so that they can take it home. You cannot reuse these syringes for other clients. It's not sanitary. It's been in their hands and in their mouth. Please allow them to take home the gel. There are instructions inside the kit as well. This will be great for them for when they take it home in case they need to do another 20-minute treatment or so themselves. And then of course there is the dental bib that will go on the client's neck.